Hello and welcome to this tutorial on the palate, which I've decided to separate from the tutorial on the oral cavity, right? So the term palate simply refers to the roof of the mouth, and it partitions the oral cavity from the nasal cavity. It's going to be divided into a hard palate and a soft palate. The hard palate forms the anterior 4/5, whereas the soft palate forms the posterior 1/5. Beginning with the hard palate. The hard palate, its anterior 2/3 will be formed by the palatine process of the maxilla. If you remember the lecture that we had on having an introduction to skull anatomy. Then the posterior 1/3 is formed by the horizontal plates of the palatine bones, right? And on its inferior surface, you expect to find an incisive fossa, which is simply behind the incisive teeth. So it's somewhere here. That's where you have an incisive fossa, right? And they open into an incisive canal. And the terminal parts of the nasopalatine nerve and the greater palatine vessels are transmitted there. Then you also expect to find a greater palatine foramen and a lesser palatine foramen. Those ones are self-explanatory. Greater palatine nerve and its vessels through greater palatine foramen, the corresponding lesser ones through the lesser palatine foramen. The arterial supply for this hard palate come from the third part of the axillary artery through the greater palatine artery, the venous drainage into the pterygoid venous plexus. Then in terms of nerve supply, you talk about the greater palatine and the nasopalatine nerves. Of course, the branches are coming from the pterygopalatine ganglion. Then lymphatic drainage into the upper deep cervical lymph nodes, and some of the lymph would drain to the retropharyngeal lymph nodes. Then the soft palate is simply a soft mobile muscular flap which hangs down, right? And it separates the nasopharynx from the oropharynx if you've watched the video on the pharynx. Right. So this is a fold of mucous membrane and it encloses 5 pairs of muscles. In terms of epithelium, you expect pseudostratified ciliated epithelium, which is your respiratory epithelium. And you're going to expect to find those 5 muscles being the tensor palati. You also expect to find the levator palati, the palatoglossus, palatopharyngeus, and the muscularis uvula, right? So these are just pictures showing you what you expect to find in the oral cavity. That's another good picture. Then I would like to dwell a bit on this one. That is tensor veli palati. Then that is levator veli palati. That is palatoglossus. This is palatopharyngeus. Right. All these muscles, they're extrinsic to the soft palate, except the musculus ovuli, which is intrinsic. Right. I will not bore you with origin and insertion of these small muscles, but in terms of the nerve supply, all the muscles of the soft palate are innervated by the cranial root of the accessory nerve through that pharyngeal plexus, except the tensor palati. The tensor palati will be innervated by the nerve to the medial pterygoid, which is coming from the main trunk of the mandibular division of the trigeminal. That nerve to the medial pterygoid also innervates the muscle itself, the medial pterygoid muscle, and the tensor tympani of the middle ear. Right. Then you talk about something known as a gag reflex. So sensory supply for the palate, you talk of the lesser palatine and the glossopharyngeal nerve. So the gag reflex is simply a protective reflex. And I'm sure everyone knows about that. And the afferent limb of the reflex that is bringing the sensory, it's your glossopharyngeal, then the efferent limb is the vagus. So if you affect any of those nerves, you lose the gag reflex and you're going to have things going through without stimulating this reflex. And paralysis of the soft palate, on the other hand, that is due to the lesion of the vagus nerve, will produce a nasal regurgitation of liquids, as well as deviation of the uvula opposite to the side of the lesion. This will become very important when we start to describe the neuroanatomy of the brainstem. Then the soft palate is given blood supply through the ascending palatine branch of the facial artery, as well as palatine branches of the ascending pharyngeal artery. If you remember, these branches were passing in the gap or the interval between the superior constrictor muscle and the skull. You also expect the lesser palatine arteries from the maxillary artery to give blood supply to the palate. The lymphatics, retropharyngeal and upper deep cervical lymph nodes, I mentioned that when we began. Then clinically, you talk of a cleft palate, which is basically defective fusion of various segments of the palate during birth, or not birth per se, but during life in utero. So you can have a unilateral complete cleft palate, or a bilateral, or you can talk of an incomplete or partial cleft, right? All those can occur in the palate, right? So that's how you generalize the palate. Then I'd skipped origin and insertion. I won't really want to bore you with that, but just remember, levator palati, right? It inserts onto the palatine aponeurosis, where it originates the auditory tube. Tensor palati, where it originates the auditory tube, the cartilaginous parts for the auditory tube for both, right? So that's just about it. Pleasant viewing.